Zinc, another essential micromineral. Sources: animal sources and vegetable sources. Animal sources includes liver, milk, dairy products, and eggs. Vegetable sources includes unmilled cereals, legumes, pulses, oil seeds, yeast cells, and vegetables. Recommended daily allowance: as per the average requirement of zinc about 0. 0.3 milligrams per kg body weight. Infants and children required 3 to 15 milligrams per day. Adults required 15 to 20 milligrams per day, and pregnant and lactating women required 25 milligrams per day. Now, body distribution. An adult man of 70 kg approximately have 1.4 to 2.3 grams of zinc in the body. High concentration of zinc found in skin and prostate, approximately 70 to 86 milligrams per 100 grams. Average concentration found in bones and teeth, approximately 15 to 25 milligrams per 100 grams. And low concentration found in kidneys, muscles, heart, pancreas, and spleen, approximately 2.3 to 5.5 milligrams per 100 grams. Very low concentration found in brain and lungs, approximately 1.4 to 1.5 milligrams per 100 grams. Blood. Whole blood contains about 650 to 680 micrograms per 100 ml in RBCs, especially zinc containing enzymes, carbonic anhydrase, and white blood cells as a zinc protein complexes. In plasma, level of zinc about 120 to 140 micrograms per 100 ml of plasma. Now absorption. Approximately 20 to 30% of ingested dietary zinc is absorbed in small intestine. It's then transported in blood plasma and mostly by albumin and alpha 2 macroglobulin. In mucosal cells, zinc is associated with some proteins called non-specific binding proteins, metallothionein, and cysteine-rich intestinal proteins. Non-specific binding proteins and cysteine-rich intestinal proteins both are involved in digestion and absorption of zinc, which make a complex with zinc they able to interconvert it into metallothionein. Metallothionein, when it associated with zinc, basically metallothionein is a storage form of proteins. Needs zinc, when body needs zinc, zinc released from metallothionein and further ex- transported to rest of the tissues. When body not release, when body not need zinc, zinc further kept stored in mucosal cells. Zinc may be absorbed by passive diffusion. In non-saturated state, zinc diffuses from mucosal cells to serosal pole, so where it saturates with albumin. कुछ ऐसी डाइटरी एलिमेंट्स जैसे कॉपर, कैल्शियम, फॉस्फेट और फार्टिक एसिड ये जिंक की एब्जॉर्प्शन को इंटरफेयर करते हैं, यानी कि जिंक की एब्जॉर्प्शन को डिक्रीज करते हैं. Look at this figure. This figure shows that zinc, dietary zincs from food, come in mucosal cells of intestine from where it further digested and absorbed by two regulatory proteins called non-specific binding proteins and cysteine-rich intestinal proteins from where zinc stored in metallothionein. If here we here the two possibility occurs. If the body needs zinc, metallothionein release zinc to albumin and transferrin for further transport to rest of the body as well as peripheral tissues. From here, zinc is further transported to pancreas. The pancreas use zinc to make a digestive enzymes and secrete that enzymes into intestine for further digestion and absorption. If body does not need zinc, zinc is not absorbed and is excreted in shed intestinal cells. Zinc is excreted via urine, bile, in pancreatic fluids, and in milk of lactating mothers. As we say here, the zinc absorption is reduced when the body does not need zinc. Now, biochemical functions. Number one, role in enzyme action. Zinc as integral part of several enzymes called metalloenzymes in the body. Superoxide dismutase present in cystole in present in cytosol of brain cells, liver cells, and blood cells. Here the zinc make a complex with copper, carbonic anhydrase. A zinc containing enzyme carbonic anhydrase available in RBCs, in parietal cells, and renal tubular epithelial cells. Leucine amino peptidase, another zinc containing enzymes of intestinal juice. Carboxypeptidase A of pancreatic juice, and other examples of zinc containing enzymes called alcohol dehydrogenase, retinine reductase, alkaline phosphatase, glutamate dehydrogenase, lactate dehydrogenase, and DNA and RNA polymerase. Now, role of zinc in vitamin A metabolisms. It should be reported that zinc involved to stimulate the release of vitamin A from liver to blood and increase the level of vitamin A in blood. It's also zinc also involved to utilize vitamin A in rhodopsin synthesis. Utilize in rhodopsin synthesis. Number three, role in insulin secretion. Zinc involved in storage and secretion of insulin. Rise of blood glucose after administration of glucose, increased release of insulin, and simultaneously lowers the zinc content of pancreas, especially of beta cell of islet of Langerhans. Number 4. Role in growth and reproduction. Deficiency of zinc may lead to dwarfism and hypogonadism, pubic disappearance of pubic hairs, and do not grow. However, intake of zinc supplements improve growth and development of pubic hairs. जिंक डेफिशिएंसी स्पर्मेटोजेनेसिस को लोअर कर देती है इन मेल्स और मेस्ट्रुअल साइकिल्स को डिस्टर्ब कर देती है इन फीमेल्स. Role in wound healings. Zinc is necessary for wound healings, has been found to accumulate in granulated tissues and in and around the healing wounds. Number 6. Role in biosynthesis of mononucleotides. In biosynthesis of mononucleotides and their incorporation into nucleic acids has been found to impaired in zinc deficiency. जिंक एक एंजाइम जिसको राइबोन्यूक्लियेज कहते हैं इसकी एक्टिविटी को भी इंक्रीज कर देते हैं. Now the deficiency manifestation of zinc. Zinc deficiency has many causes, but malnutrition and malabsorption are the most common. Clinical symptoms includes road failure, hair loss, reduced taste activity, hypogonadism, delayed wound healings, loss of appetite, as well as defect in taste and smell. Disorders in zinc absorption may also lead to inherited disorders called acrodermatitis enteropathica. A rare inherited disorders, inheritance autosomal recessive, in which the zinc absorption that causes low plasma dis- disorders in zinc absorption that causes the low plasma zinc concentration and reduce the total body content of zinc. It is manifested in infants as skin rashes. Clinically, disease is characterized by dermatological, ophthalmological, gastrointestinal, and neuropsychiatric features along with growth retardation and hypogonadism. Treatment of acrodermatitis enteropathica is dose of zinc is given up to half to 1 milligrams per kg body weight about 1 to 3 times a day just to decrease the risk factor of acrodermatitis enteropathica. This slide shows the clinical features of acrodermatitis enteropathica, a disease characterized by dermatological, ophthalmological, gastrointestinal, and neuropsychiatric features along with growth retardation and hypogonadism. At the end of the topic, dear students, you should allow to describe the biochemical role of zinc in the body as well as enlist the sources of zinc and also write the name of proteins which involved in absorption of zinc.